Ladies and gentlemen, join me as we welcome Dr. Catherine Namuludu to take us through on this topic, dynamic work environment, effects of mental health, broken down into the two subtopics. Karibu sana daktari.
Thank you very much for that welcome. I already feel at home. Allow me to share my screen as I start this discussion. I'm happy to be here this morning to discuss this pertinent issue of mental health, especially how to enhance mental health in our universities. And a brief bio has been given about myself. So that is me. It's important that we are looking at mental health at this particular time, because if we don't prioritize mental health, then there's going to be a problem in the long term. Unfortunately, mental health is not something you realize at once. It has long-term repercussions. Most of the time when you have a physical health, like you have malaria or you have typhoid or you have COVID like it was, unfortunately, you will get physical symptoms where people are coughing, they have headache, they have body pains, and you are able to explain how you feel to someone and they understand you. Unfortunately, when you have a mental health challenge, people see the consequences of your behavior and they start extrapolating that there's something which is not right with you. And most of the time, people do not understand what is actually not right with you. And there will be a lot of explanations before they pinpoint what could be the problem. And this means a lot of time is lost and wasted, and sometimes opportunities to help this person to come back to proper functioning. So when we are talking about mental health, what exactly are we talking about? And mental health it exists in various categories. It will be about your emotions, the way you are able to function emotionally, and that is a subjective state of mind which we may not be able to touch. If somebody is emotionally disturbed, as the person observing that other person, you may not know what they are going through or how they are feeling. They may be anxious. If I am anxious, that is an emotional feeling. You may not touch my anxiety. You probably will see my behavior. I'll be shaking. I'll be restless. And that is the only thing you can identify. This person does not seem to be well. And most of the time, if you are not observant, you may not even notice this. So mental health encompasses the whole person and how they are able to interact right from their internal subjective functioning of their state of mind. And then now this is seen in the cognitive decision-making, how they make their decisions, how they behave when they are faced with challenges, the normal stresses of life, because life is full of stress, how you are able to cope with those challenges. Like at the workplace, you have work overload. How do you cope? And then how you behave socially, your social relationship within the people, your bosses, your subordinates, and your peers. So all these three aspects of this person, their emotional well-being, their decision-making, and their stress coping skills, and then the social relationships, and how now they are able to contribute gainfully to the community and the society. So a combination of factors determine your mental well-being. And this now will include your biological makeup as a person. We say you may be genetically predisposed to mental health problems, to anxiety, probably, to substance use. You may be genetically predisposed to having mental health problems like psychosis, schizophrenia. Some of these things run in the family and they come with their genetics. And with this, the social environment in which you live in is very important. There are people who have this genetic predisposition to mental health problems, but if they live in a supportive environment, they have social circumstances are protective of the problem, like they have family cohesion, they have peers who are supportive, they have supportive workplace environment, then this enhances their psychological well-being, the way they feel about themselves, their self-esteem, the value they attach to themselves, and the coping skills they have. So all this will determine whether someone will get how their mental well-being is going to be, whether you're going to tip over to get a mental illness, or if you can maintain a balance. So mental health is about maintaining that balance. And this is actually what we call mental well-being. That you are able to practice good skills on a daily basis, and you pursue a goal with a purpose towards maintaining stability in your life. You exist even with the issues you're going through. You are able to cope. Why university setting? And the thinking is that it is an ideal setting for prevention and support services for people who have mental health challenges, because it provides the opportunity to have programs and strategies which prevent mental illness, and especially drug use that mostly tends to start in college. What we found in this study we did, and reviewing other known data, is that when students or young people are transitioning from one point of their life to another, like moving from secondary school to universities, they are likely to start substance use. So once they get to university, during their first year and while they're adjusting to the university environment, that's a very important environment to help them cope and not continue to use drugs, those who may have started using, because we have also realized substance use is beginning way earlier in campus. And then in the university setup, there are many individuals who are committed. Like I have seen at the Karatina University, the commitment right from the topmost office of the Vice Chancellor to everyone else is even a committee which is working on how to prevent substance use and looking at strategies. So this is a very important opportunity, and it's a discussion which is timely. We should continue to have on what we can do about this. How has COVID-19 affected our mental well-being is a question we have to think critically and appraise. And we saw about the disease when COVID-19 came to Kenya, especially in 2020, March. It's about that, March 15th is when the first case of COVID-19 was reported in Kenya. We saw the amount of anxiety and uncertainty that prevailed in our country and worldwide around that time. Just the disease process itself, we didn't know much about COVID-19 then. And what we knew was that COVID-19 was a death sentence. You get COVID-19 and you're gone. So there was a lot of frantic efforts to keep COVID-19 at bay. And I remember how scared we were when we had that the first person actually arrived in Kenya. And the person was identified, a lot of commotion with it. And we saw even then people being taken to isolation centers. Until we lived in this country, we saw the drama which came with it. If someone was reported to have or suspected to have COVID-19, how people would come clung in those we call them PPEs, personal equipment. They're dressed like they're going to the moon, and they'll come, and even your neighbors will be standing watching at a distance when you're being whisked away in that ambulance, and it will be a lot of stigma even for the family. I remember around that time, I was working with the Ministry of Health to support psychological support and to put in structure how to support even the frontline healthcare workers, because they were being stigmatized by their own family. The first day I left home going for a meeting in Kenyatta, my family was very worried. You're going there. And when I came back to the house, people did not know how to interact with you, because they are thinking, do you have COVID? Have you seen anyone with COVID? How do they look like? And then, unfortunately, our worst fears were confirmed when now the mortality started coming in. People started dying. And I don't think there's anyone in Kenya today who did not get an experience with COVID-19, knowing somebody, a relative, a friend, a workmate, a neighbor, someone who got sick, who contracted COVID-19, and even somebody who died from the disease. So that is the reality we have lived with. So with this, that anxiety, that lack of knowledge, it has an effect on our mental well-being, like we've said. With this now, there's been a lot of mental health problems reported. Once the universities have opened and we have to deal with our students, they are coming to see us with stress-related complaints, anxiety, depression. Most of them feel isolated. The cases of suicide being reported and students harming themselves and harming others have gone in the increase, is what we have seen. And will all this overall, for all of us, there's a lot of economic strain. Like now, even schooling, we've seen the school calendars disrupted, where we have to pay school fees every about 2 months. Every 8 weeks, we are moving into a new term, and you have to pay school fees. So there's this high cost of living. Just this ending week, we've had problems with fuel in this country. I'm sure you experienced it in Karatina as well. And at the end of it, even the cost of fuel went up, the cost of cooking gas has gone up, and everything you touch has gone up. And all this coupled with this loss of business and loss of reduced earning. So all these are effects of COVID-19. We are focusing on how can we help, how can we support ourselves, our staff, our students, to get resilient and to move past this stage and cope with this situation we find ourselves. That is the question. We did a survey at the University of Nairobi, and we found that this survey was done in January. We found that looking at the last 1 year, while students were away, students have continued to use drugs, and alcohol is still the most commonly used drug by university students. The second most used drug by university students is cannabis, the use of cannabis in various forms. And we found 25% of college students, they reported that they'd actually used cannabis in the last 30 days. And 6% of them reported that they were using cannabis on a daily basis. Every day they have to use cannabis so that they function. And another worrying trend we found was that students are using sedatives. 5% of the students were using sedatives. Sedatives is a combination of drugs which give them a high prescription medicine. And we have heard of the opioid crisis in the in the world currently going on. Students using drugs like tramadol, codeine, betapine. So students reported that they are using these substances, a combination of substances, some of which they cannot even account for, because they will say it is just a tablet they are given, which makes them get a high. So we are concerned because with this kind of use, this is where our students are finding solace. And now with this, it can only make their coping mechanisms more difficult. So now we come to the question we are asking: what can we do to enhance mental wellness in campuses? Or why is it even necessary? So we need to get a strategic framework for prevention and supportive programs at the workplace. And we have what we call employee assistant programs and student assistant programs. At the University of Nairobi, that is the program we run, that we have a way of employing, of identifying students and staff and their dependents, staff dependents, who are struggling with their mental health. You've noticed from the appraisal, and nowadays we have the appraisal system, that someone is not meeting their targets, someone productivity is reduced at work, or they have been known to be using alcohol or other substances. Then these people are identified, and when they're identified, not to be punished. These are not punitive programs, but given to the right programs or units where they can be helped, where they are specialists. So those areas have been set up. So, and you build the capacity of these people for them to be able to help. Then we have planning of the activities which will be implemented. And then with this, we have continuous monitoring of this implementation and the evaluation of the progress. So basically, this is the new way to go. We need to have a strategic prevention framework. So why do we need this dynamic strategic prevention models? It's because they use data. It's important to start from somewhere. We need to have baseline data of what issues do we have. And when we use data, we use that data to make decisions on what we need to do. Then we create models that are circular rather than linear, and then models that encourage teamwork. Everyone needs to come on board. Once you have identified what are the unique needs of your institution, then now you make a prevention and a supportive plan which is uniquely tailored to your needs. And in-person college workshops are still going to be very important for our students. We have also realized, like for us, using students as peer mentors to reach each other has been quite effective. So now we are training people we are calling mental health champions. We've given them a lot of empowerment, and they reach out to each other in their informal setting, when they are in their group discussions, when they are in their halls of residence, and as they interact with each other. So we have these students we have enabled, because I'm sure like we find in most institutions, we don't have enough counselors or enough personnel for every student we have. But if we have a critical mass of students who are empowered, then they can be champions, they can champion mental health. And also for the staff, we train staff as mentors, and they can have this discussion even in their departments. Another thing which we have seen working is use of innovative prevention and support strategies, especially the use of online platforms. Because everything has gone online now, our students sometimes we have seen when you call them for in-person programs, they do not attend in big numbers, but they are always on their phone. The use of mobile phones is quite high. There's high penetration of mobile phones. So can we have programs which students can access, mHealth-based programs, podcasts, digital stories, use those social media platforms where we find students. At the University of Nairobi, we have a program we've launched. We call it the RADA app. The RADA app was actually developed by students and with input from the experts. So students told us what they would want to know about, and because we realized students will not come for counseling, so they download this app and it has a lot of information. It has a lot of information that students can access. If you want information on substance use prevention, on sexually transmitted diseases, abortion care, all these mental health concerns, anxiety, depression, we have put that information there so that a student can access it. And then there's a provision that if they find they need questions, then they can connect to a counselor anonymously. Even the counselor will not know whom they are talking to, but they can ask those questions and we can have an online counseling session. And we've seen this work, and this program is open. The university, it was supported by UNESCO, and the university is willing to open it to other universities. Mount Kenya University has come in. I'm sure it is something, a discussion we can have on how you can customize it for your own needs. We, as a department, we are working with the Department of Communications at the University of Nairobi, where we are having their students make these podcasts. Podcasts are short stories. They talk about student issues, and they listen to them, the Department of Communication. They are making digital stories. And we've seen students, this bringing a lot of discussion around mental well-being. So these are strategies which we can think through. Can they be useful in our institution? And is it something we can approach? So once you have your mental health champions, the mental health champions we have trained are the ones who are making these podcasts, making the digital stories and these TikToks, and then they disseminate around the university students. Social events, I saw this was from the Karatina University website, and I found this useful. So now we said one of the things COVID brought was isolation. So with relaxing of COVID protocols, these are areas we need to go back to. Social events are very important for our students. They are very energetic. How do they come back and interact and showcase their talents? So these are things, I know we have lost time on studies, but we also need to put time for social interaction and talent building. Sports, I was very encouraged to see that sports is very integral at Karatina University. There's even a soccer team, a women's soccer team, there's tennis, karate. So these are things which we need to bring to the forefront at this point. People need to express their frustrations. These are ways you can use to fight your anxiety. So there are things we encourage. Sports and games should also be prioritized. You have a role to play to take care of yourself. You need to prioritize your health. And when we are talking about self-care, it's just those basic pertinent things you can do as a person to keep you grounded, to bring you back to your center, to your core. And one of the main things is just to Eat a balanced diet. Do not miss your meals. Despite the work we have, despite the engagements we have, eat a healthy diet. Get enough sleep. We say at least 8 hours of sleep is important. When you sleep, your body relaxes and rejuvenates. So anxiety levels will come down. Get time to meditate. Just be with yourself and focus on yourself. So at those levels, when you feel anxious, you feel depressed, you feel worried, just take time to sit down and have a quiet time. Amidst all this, increased physical activities is very important. Exercises, those who can run, those who can walk, joining karate clubs, anything you can do to keep active is very important at this point in time. Put down your thoughts, journal. We say you should have a gratitude journal. So many things have happened. People have suffered many losses. But when you look within your life, there's something to be grateful for. People have lost lives, but you are still here. People have lost a lot, but you still have something going for you. You are working, your work is still there. You have life, you have people around you. That is something to focus on. We keep a positive attitude. Then we need to keep off drugs. These drugs of abuse, we're talking about alcohol, cannabis, caffeine, all those drugs are going to make your situation worse. So take a minute and prioritize taking care of yourself. We say self-care is not being selfish. You cannot pour from an empty cup. You need to refill your cup regularly so that you can give to others.